As you've probably noticed, today is Mental Health Monday, and today we're welcoming Lacey Castilleja Fisher, who specializes in lots of things: reproductive mental health, grief, loss, and sexual abuse. She's here to talk to us more about who she helps and how, and we're grateful for her expertise today. Lacey, good morning.
Good morning, thank you.
Let's talk a little bit about your work and how you got into it.
Well, I will be honest, I got into this work as an undergrad. It was really hard, transition to college.
Went down here at UT?
Yes. Then started seeing a therapist, and it was eye-opening at how wonderful healing it was just to share your story, have someone else help you see it in a different way. And it's like that became a calling. And I said, this is what I want to do, and shifted direction to that. So I immediately went to grad school to study counseling.
Wonderful. And you've got a lot of things that you do now. I was pleased to see a therapist for therapists.
Yes.
Because our therapists need help too. My goodness,
Absolutely.
probably more than anybody. But tell me about the kinds of patients you help and about some of your different specialties.
Yeah, so open heart counseling is what I created or co-founded or founded myself.
Yeah, you're giving credit to somebody who isn't there. It's all Lacey, y'all. It's all Lacey.
I do have several clinicians under me that we all see a variety of things, and play therapy is one of them. But my specialty has gone to working with perinatal mental health, reproductive, trauma and loss are my main specialties.
Okay. Yeah, and it's a big one. I think anyone who remembers the previous co-host of the show, Stephanie Gilbert, she was really open about her infertility journey on social media. Now has 2 happy little ones at home, which I'm so grateful to be able to say. But it has been taboo, really, in previous years to talk about infertility or reproductive struggles. Can you talk to me about what someone might be going through when they're having some of these problems?
Whether it's that you're struggling to try to conceive, or going through IVF, having multiple transfers and cycles that don't work, to getting pregnant or losing, or having a loss during the pregnancy, and postpartum. There's just so many things, right, that can come up, and people can find themselves feeling a tremendous amount of anxiety that they've never had before. So that's a lot of what I see, especially the pregnancy after loss aspect, that people don't feel safe. They're like, there's no safe zone. I want to have this pregnancy, but oh my goodness, I'm terrified. I don't know if I'm going to get there. I can't embrace this.
Well, and we use the term a lot in a very joyful way, a rainbow baby, which, if folks don't know at home, is the pregnancy or the happy birth of someone after you've lost a baby, right?
Yes.
Can you talk to me about all the different types of reproductive loss someone might experience? Because I was shocked to see that the number was so high.
Yeah, there's so many, and I probably won't be able to say them all, today. But like I said, starting from trying to conceive, not being able to, then saying, oh, well, okay, it's a loss of, now I maybe need assisted technology to help with this, to embryos not forming. There's embryo loss, and then anywhere from pregnancy, early miscarriage, middle term to late term stillbirth. Like some people ready to go to the hospital next week and deliver at 40 weeks, and at 39 they deliver stillbirth.
My friend had umbilical cord wrap.
Yeah,
and some got to the point of, healthy boy, 9 months, and passed away on the day of his birth.
Yeah, and then after that, infant loss, early childhood loss. So there's a whole spectrum, a whole wide range of it, and that's what we'll see in the work I do. And I also want to include TFMR in the loss conversation.
What's TFMR?
Termination for medical reasons.
Gotcha. Okay. I think what's tricky for those of us